My name's Alex Meredith. I teach anatomy and neurobiology. I am also a trained medical illustrator and love to do fine art on the side. Wow, April 26th. It was a beautiful night. Had a barbecue and we're making dinner, and after dinner was over, I was cleaning up, and it just hit me that I couldn't see my left hand. And so I did the sign of like moving my left hand for the periphery, and it sure enough, it disappeared. And then I closed my left eye to see if my right eye, and it disappeared in the same place with my right eye. And I knew what was going on immediately, but what strikes me most is how quickly a stroke happens without any sign. Just like a curtain went down on half my vision. I remember trying to look at my watch to know what time it was, and I couldn't see the left-hand side of my watch. And so I kept on moving, and I could see these two hands pointing to the left. And I'm looking at that, and it's telling me that it must be around 8:45. And so that's really almost exactly when it started happening. I was anxious because I knew that there was only a certain amount of time that it could be treated. I needed to go to Johnston-Willis. I'd already figured that out because we're sort of equidistant between a number of hospitals, but Johnston-Willis has such a great reputation for neuroscience treatment, so that was sort of a no-brainer.
The Johnston-Willis Comprehensive Stroke Center represents the highest level of stroke care. Patients that are referred here have a full range of options for a large variety of cerebrovascular disorders. Comprehensive stroke centers basically provide every kind of treatment for every kind of stroke patient that may come through. A comprehensive stroke center does represent a multidisciplinary team for the patient coming in here with a cerebrovascular problem, be it acute or chronic. We have the full complement of technologies and skill sets available to provide them with the care they need.
The team just leapt into action, and I was immediately taken to a CT scan. I know enough about the stroke that they have to determine first if you've got a cerebral vascular bleed or just a clot that has plugged up the inside.
The folks who lose blood flow to a part of their brain, they receive intravenous clot buster, better known as TPA. And what we offer here on top of that is the endovascular stroke rescue, the mechanical thrombectomies, which have been shown to provide a marked increase in the disability-free rate. And we offer that service 24/7.
They gave me the TPA. I remember they were wheeling me down the hallway, and it was about 10:30 that night. Because I remember I could see the clock, and I could see the walls going by me as they were wheeling me down the hallway. I said, it worked. I was practically in tears. It was just because I knew it's really serious. And being an artist, losing your vision is like Beethoven losing his hearing. It'd be really hard to live with. The radiology department did an MRI scan of my brain, so I got to look at my own brain and actually examine. And there's no areas that there's a big hole in it, or anything like that. It looks just like the normal brains that we teach to the medical students. I can now prove to them I have a normal brain. Without science, I would be a very different person right now. I would be dependent on people to take care of me. A lot of the joy of my life is my family. And I'm incredibly thankful that I was rescued by the treatment that was provided me at Johnston-Willis. I can't really pinpoint one person. It was just like, I don't feel like I'm cheating anybody by just saying Johnston-Willis, because everybody was part of this team. Through the ER, through the doctors at the neuroscience intensive care, and the nurses that spent the whole night with me because I couldn't sleep. They allowed me to continue with the joy of life. I guess as a scientist, I'm the living beneficiary of many of the advances science has had, but without a team that has jumped into action, knew all the right things to do, they're just terrific. I'm so lucky I landed on them. Or they caught me. How about that?